Good afternoon, all, or good morning, because I know that we have attendees from all over the world. Welcome to the first live virtual event show of this Barcelona Health Hub series. It is a pleasure to have you all here virtually. We hope you are all keeping safe and strong. My name is Maria Luisa, and I will be in charge of moderating this session. But before we start, I would like to share with you how this is going to work. First, we are going to listen to our three top panelists. They will be talking about digital health in pandemic times. Then we will have the open discussion where I will make some questions just to go deeper a little bit into this interesting topic. But the most important is that you are also part of the conversation. Since now the chat is open on the website, so any questions you want to ask are more than welcome. The panel will answer your questions during the discussion time. So now that we are all on the same page, I leave the floor to Luis Badrinas. Luis is the CEO of Barcelona Health Hub, and he's going to give us a little bit more information about this Barcelona Health Hub series that we are opening today. Luis, good afternoon.
Hello, good afternoon. Hello, everyone. It's a great pleasure for me to introduce Barcelona Health Hub series initiative to discuss how digital health solution can help in time of pandemics. Since we've been confined at home as a result of COVID-19, we have thought about enhancing the communication of those initiatives in the Barcelona Health Hub ecosystem. Many of them helping people through information platforms about COVID-19, contributing to avoid the collapse of hospitals. So we are planning to organize these virtual events like this once a week to inform you about all of those projects that are helping for this pandemic. In parallel, we have already launched a project to promote telemedicine as a fair consultation and triage service, trying to digitalize, improve, and simplify health attention, promoting the digital health transformation, modifying legal framework, and also improving the people's life. So thank you very much for your attendance. Thanks to the presenters and the moderator. So Maria Luisa, you have the floor to introduce the panel. I hope you will enjoy. Thank you very much.
Thank you very much, Luis. I'm sure we will enjoy it too. And for that, let's start with Mediktor. Mediktor is the most accurate artificial intelligence-based medical assistant for triage, pre-diagnosis, and decision-making support. And very important, it is the only clinically validated one. They also have developed a coronavirus assessment tool. So let me introduce you to Cristian Pascual, CEO of Mediktor. Cristian.
Thank you very much, Luis and Maria Luisa. Thank you for organizing this. We are living strange times, and I think that in digital health now we have not only the opportunity, but the mission to try to help as much as possible to the health professionals. But let me start sharing a little bit what Mediktor is, really brief, and then trying also to share what we have built up. Can you see the screen? Okay, so in Mediktor, what we have been doing is assess symptoms online to guide patients to the right level of care. People, when we all feel sick, we do the wrong thing. Typically, we Google our symptoms, we try to find out what to do next, but healthcare has been, as for today, a physical business. You need to move and seek for help. So we try to build up a medical assistant to guide you from symptoms to the best next step. So we have built up an artificial intelligence-based gatekeeper for healthcare. And this is a very easy to use tool where you start a conversation with Mediktor, just telling how you feel in your own words. It's just having a conversation with a real doctor. And in just 12 questions and 4 minutes, you will have an advice on what to do next. This is Mediktor as it is for today. And of course, due to the situation, all our clients start to ask about a specific assessment related to the coronavirus crisis. And I would like to share a little bit what we have learned these days, because I think all this situation is new for all of us. What is happening today is that people at home is feeling symptoms, and they may be from coronavirus or many other things. I mean, people are still living a normal life, and they could have other disease. So the big deal right now is that everybody thinks that they are having coronavirus. So that what they do is they massively call the call centers and rush to the hospitals. So the problem is all call centers and hospitals are saturated. What we see as the best practice that has been some governments doing is to try to live at home everybody that is not having a severe problem or an urgent problem, of course. And that's a huge effort these days because there's an incredible demand for care. So what we have built up is an assessment that really can triage these people in their houses. And in our experience, 80% of the consultations we had in the last 6 days, 80% were that they were not suffering the symptoms related to coronavirus. Only 15% were symptoms related to coronavirus, and from these, only 4% was a severe. Well, sorry, it's 80-20. 15, it's yes, possible positive, but not severe, and 5% severe. Of course, the severe, they should rush to the hospital or do the local protocol. And 15%, what is more, I understand, scalable and reliable is to try to leave them at home and be tested at home. So our help could be to provide this tool to manage this huge demand in an efficient and a scalable way. So this is pretty much what we have built up, this system that can be embedded into any interface that you have with your clients. Could be apps, could be web, could be even a chatbot with text or just a voice assistant to help you as a government, as a health institution to manage all this huge demand. Because, and it's, I think, compared to what we have seen that some institutions have built up, which is a simple list of 4 to 8 questions asking for which are the specific symptoms related to the COVID-19, it's a big difference from what we are doing because we can provide a differential diagnosis. So if we see that you could be suffering another disease, we will pre-diagnose this disease. So it's much more effective on letting the anxiety down from the people that they still feel these symptoms and they want to have a response, even it's coronavirus or another thing. So I think this point is very important because it also makes sense not only today, but tomorrow when it will be people that could also have coronavirus. I'm talking about summertime when the big wave is done, but we still have to figure out what these people are suffering. So it's not just a solution for today, it's a solution that will be useful in the future to triage and guide people to the right level of care. And well, I will be happy to talk to anyone interested to use our technology. Let me just close the presentation and say goodbye with my face. Okay, so it's better to see the presentation than my face, but thank you everyone, and please, Maria Luisa, go ahead.
Thank you very much, Cristian, for your presentation and for your face. Looking forward to knowing more about how online pre-diagnosis is meant to be a game changer. To the public, to the audience, let me remind you, if you have any question, you have the opportunity to write them down in the chat, okay? Then the panel will answer you. In case you haven't noticed, the chat has two options, live chat or highlighted chat. In Spanish, it says chat en directo or chat destacado. We recommend you to go to the live chat, chat en directo, so you can follow the conversation in real time. Okay, this is just a suggestion. And well, now let's continue with the next presentation. Now we're going to know more about HumanITcare. HumanITcare is currently providing digital health monitoring platform to hospitals for free. The benefit, healthcare professionals will be able to monitor and treat patients with COVID-19 from home. That means less risk of transmission. To know more about this monitorization tool, now it is time to listen to Nuria Pastor. She is the CEO of HumanITcare. So now, Nuria, the floor is yours.
Well, first of all, thank you so much, Maria Luisa, for this great presentation. Thank you so much, Barcelona Health Hub, to have this space to share this initiative that nowadays are very important to face these pandemics that we are living. I will explain you what are we doing at HumanITcare, and then I will explain you why we started this initiative to put for free the platform from hospitals that need our service during the crisis of this pandemic. And then we will explain you more about some outcomes of the company and other things. So I will share my screen with you. Okay. I think that now you are seeing the presentation. So yeah, we are HumanITcare, and we are an artificial intelligence remote telemonitoring platform to provide better access to healthcare. So what we are doing at HumanITcare? At HumanITcare, we are facing and trying to improve how healthcare is delivered. Nowadays, as we have seen with all this crisis of COVID-19, the healthcare systems are not really prepared to all the demand of population that are having. And what this doesn't mean? This means more expenses for the hospitals, more time doing follow-ups, and loss of data because we cannot really understand how these patients are doing from home. At HumanITcare, we are working for more than 3 years in this platform. This platform, it connects the patients with the professionals. We collect different sources of data from wearable devices, as for example, Fitbit, Apple Watch, or other devices. Also data from the sensors of the phone as GPS and other data, which is very important to really understand the behavior of these patients, and others as pulse oximeters, mass scales, and also, of course, the program of follow-up that it's like a surveys, smart surveys that the doctors receive on the website. So the doctors have a website when they can see in a remote way how the patients are doing from home. Now we are working in this COVID-19, but I will explain you in general how can we narrow this gap that we see between this follow-up of these patients. So this is our platform. As I mentioned you before, this platform is for the doctor. The doctor has all the patients in a same dashboard, and the patient has an application which is able in the Apple Store or iOS Store. And in this application, this patient is receiving questions and, of course, collecting the data, which is critical to measure how this patient is doing from home. The patient can connect their smart devices, and all the data that is relevant for this doctor, it appears as a notification that is sent to their email, so he can see how this patient is doing from home. So what is this new scenario that HumanITcare is providing? We are providing, of course, like an accessible application and platform, and we are reducing the cost of the healthcare systems. In some studies that we have been doing with hospitals, with local hospitals, we can reduce up to 60% of this follow-up. And of course, we are providing a remote 24 hours monitoring. Now I will explain you, well, first of all, why we started this initiative. We started this initiative because what we are doing now is a very, very hard reality. The doctors and the healthcare systems they don't have like the resources to really monitor not only patients with COVID-19, but other patients that have chronic conditions and are still in this process of doing these follow-ups. So how can we help? How can we help with our technology? The first thing is to improve this follow-up. Of course, now we are all home, trying to avoid being infected by COVID-19. So doctors can monitor and doing this follow-up with our platform. The patients have to download the app, and then automatically we are collecting this data and sending the relevant data from the doctors. Also, we can connect CPEs, so we can track in a more accurate way where is focused this COVID-19. And of course, we are preventing with HumanITcare the risk of contagion. So we are avoiding this direct physical contact and the risk of course, of getting infected. And also, of course, we are saving costs of this antiseptic material because we are doing all these things in a remote way. As I mentioned before, this is a free initiative that because we are working also with other associations that has joined this initiative, as for example, the Spanish Association of Privacy. And of course, we are open to do that with other organizations. Just to finish, we are a team of engineers, healthcare professionals working for this proposal, and you have our contact to be part of that. So I will stop. Now you can see my face. Yes. Well, so that's all, and I will be on the chat for any questions that you can have about HumanITcare.
Thank you very much, Nuria. Well, indeed, monitorization is a great way to make patients feel safe and well treated from their homes. And last but not least, let's talk about a big challenge that as a society we need to face, especially increased during crisis times: misinformation. False rumors or inaccurate information do not help citizens nor healthcare services. EpidemiXs is a platform gathering validated information for healthcare professionals, a go-to place where they can find info on symptoms, treatments, and many other cases. There is a section for healthcare professionals and another one for citizens, more focused on misinformation. To know more about this platform, let's listen to Jordi Serrano. He is co-founder of EpidemiXs. Jordi, hello, good afternoon.
Good afternoon. Thank you very much, Maria. Thank you for everybody being here at this time of this hour of this today. And thank you very much, Barcelona Health Hub. As you know, we are an association that we're trying to enhance and foster digital innovation. And in these times, this is more necessary than ever. And nobody had thought 2-3 weeks ago that we'll be here together, each of us in our homes. But this situation is bringing the best of all of us. And in that sense, most of the companies that are working in Barcelona Health Hub, they have a social component, no? And in that sense, Universal Doctor, our company, has been always working with global health, digital health, and we thought, what could we do to launch something quickly, and that would others very quickly add and join in your initiative. So we decided to do EpidemiXs. It was a success because we launched 2 Saturdays ago, and it reached 1.2 million visits just 2 to 3 days after that. But more than the quantity, what is important is the quality. What we want to do is gather all the protocols, clinical guidelines, recommendations of official institutions, administrations, hospitals, scientific societies, and gathering all of them in a tidy way, in a structured way, in a standardized structured way, where clinicians or healthcare workers can enter and find protocols, global protocols by community, by scientific society, by specialty, and so on. And also in the healthcare citizen can find all the aspects that they are looking for, all the questions and so on. Importantly, this platform is always connecting with the official sources, with the administration. What we're doing is aggregating all these things. If you allow me to make a quick, let me share my screen, a quick, a quick overview. As you can see in EpidemiXs, you can find information about professional healthcare worker with the protocols that we were talking about, different types of protocols with the final website where you can find all the protocols updated every single day, and where everybody can really fit this, as I will explain to you later, how we're working together in a collaborative way. And also you can find, of course, the information about the citizen, where you can really have all the official information with the, for example, mobile apps that the administration has launched to the population, but also here official and validated tests like Mediktor, and also many other information that are important and relevant for the different communities. Basically, we could navigate during hours here, but let me and explain that what we're doing is working together and trying to have all the information in different WhatsApps and Telegram groups, and then this information is refined under a committee of experts that they validate the information, and finally they upload information into the website. It's been a success on the last days, and even because of that, we have launched, as you can see, a TV, EpidemiXs TV, was launched yesterday. Thanks to the cooperation of many institutions, thanks also to the Ikou studio that today is also broadcasting this wonderful seminar online. And basically all together, I want to now stop sharing that, because all together we're working for one goal, which is gathering right information, validated, secure, that can be distributed very quickly everywhere, and pointing to the administration website. This is very important. We are not competing with anyone. We're just gathering, aggregating. And finally, with all these TV channels that we will be broadcasting every day, we will be touching and talking about different topics. For example, yesterday we talked about pulmonary echography, how that can help family doctors to follow up the diagnosis and take a decision very quickly to start treating people with COVID-19, not waiting to have, especially for young people, that they can resist more than older people. So just take a decision with echography. Again, technology, it's the game changer here. We talked about that yesterday. We talked about also about the myths, about the fake news, and so on. Tomorrow we'll be talking about people with nutritional problems at home, children with nutritional problems, and many other aspects. Every single day, we will be connecting the community. And we thank a lot, as always, Barcelona Health Hub, which it's part also of EpidemiXs, and they're always contributing and supporting the community in that effort. We're thanking them a lot. And actually, all the companies, societies, institutions that belong to Barcelona Health Hub, and others that are doing a social good these days, will be incorporated these next days into the EpidemiXs platform as aggregator, because people who do good deserves to be disseminated all around. Thank you very much, Maria.
Thank you very much, Jordi. Great added value to the ecosystem and to society, indeed. And well, now it is time to move to the open discussion that will last around, let's see, around 30 minutes. And well, as I explained at the beginning, we are longing for an open dialogue. That means we want your participation. So let's remember how this is going to work. Now we are opening a conversation with the three panelists. I will be breaking the ice with some questions. And if you have any questions for them related to their solutions or related to the topic of pandemics and digital health, please write them down in the chat. It is underneath the video screen, okay? And I will try to do my best for all your questions to be answered. Well, I hope everything is clear. So let's start with the first question. Are the panelists ready? Are you ready, guys? I would like to talk about adoption. Adoption of digital health has been a burning topic those past years, both on healthcare professionals and patient side. Now we are in a pandemic situation and adoption is being a bit forced or rushed on people. What is your impression? Or maybe to put it in other words, reasons why healthcare services should definitely implement digital health? I don't know which one wants to start. Is Nuria is raising her hand?
Yes. So yeah, thank you, Maria, for the question. I think that now we are like really like getting aware that that's not like an extra thing, that's a need. And now like all the telemedicine and all like the remote follow-up technology are being very, very demanded. I know that a lot of us, we have been talking with hospitals, with also institutions these weeks, because they really are asking to us to really like be there. And unfortunately, it all has to happen sometimes to really like be like really like aware that that's a need, and that the benefits here, like it's the patients, and patients need this kind of technologies. Of course, there are a lot of things to be done, but I think that now it's also the moment to really like be clear, no? and understand why this is important, and the value that it brings not only for the patients but also for the healthcare systems, because the reduction of the time and the cost for them are very high. So that's an opportunity also to them to start using these new technologies and to really like improve the healthcare system.
I don't know if any other panelists want to add something. Cristian is raising his hand. Cristian.
Yeah, thank you, Maria Luisa. No, I think that it's in these hard moments where it's not just a choice, it's a need. So something that has been obvious on my eyes for many years and had not happened because we are in a conservative and adverse risk industry. Now it's not a matter of choice, it's a matter of need to really go against this challenge that we have with all the means. And of course, all the digital solutions that are there are solutions that make the ability to go beyond the physical on healthcare, and that makes healthcare more scalable. And now it's exactly what we need to make it more scalable. And I think that on the way, we are also facing some challenges that we all know we had, like chronic conditions, aging population, more demand for health, that all these shift will help also in these challenges. So I think that today it's a need, but it will be for good also for tomorrow challenges.
Jordi, I don't know if you want to add
Yeah.
something. Let's
Yes,
go.
thank you, Maria. Obviously, right now there is a huge crisis, and obviously it's good to remember that when we have crisis, we always say we will do that, we will do that other thing, but then after some years, a crisis repeat continuously, not only in the healthcare space but in the economy. These big crises haven't happened here at least from the 1957 or 1918 in that sense. But I hope that with this new paradigm, people will get used, to the necessity that we must communicate online with our physicians, with our nurses, healthcare workers in general. We must have all these administrative issues done easily with the administration, and all that will be not a necessity. It will be a thing that people will take into already. Okay, it's already a possibility, and I need to do it. Once the administration realize that citizenship requires that yes or yes, which that now will happen, it's done because the technology is there after many years. So it's about the necessity. The problem here was before that people, if you make a survey to people, 86% of people are very happy with the healthcare system in general. That's a problem because then it takes more to take. It takes, it takes sadly what it has happened, no, to give a step forward very quickly. But I really believe that this is a game changer, and it will really facilitate the implementation of digital health. But finally, it has to be done in a good way, not overcharging the system in the way that maybe then people who cannot have the quickest access to these technologies, as maybe young people, cannot have the benefit of that, and then the family doctors that are taking care of the people with chronic conditions are more overcharged because of that thing. So all these things must be regulated and tuned and refined. But this is a game changer, and it will really change our approach to health. Not only now, as Cristian said at the beginning, this is not now just 1 month or 2 months. The next 2 years will have new peaks of the epidemic probably, and we'll have to be aware and prepare. I hope next winter, next autumn, next spring, when it comes back, we'll be super prepared, and we hope we can really implement all these systems in a full nature.
Thank you very much, Jordi. Let's now pick one question from the audience. This one reminds me when we were talking before the event, the panelists were saying they all agreed that this change is not just for now. This change will last forever. And this person is asking, do you think public administrations will promote digital health solutions from now on to ease the healthcare workload and prevent the next pandemic? I mean, is it really is here to stay? Is going to grow? I don't know who wants to start. Let's now, for example, Cristian. Now, so we go changing. Okay. What do you think, Cristian?
Well, yeah, I think, as I said, I think it's a need, and they will be forced to the adoption. But of course, it will be, as we see with the measures that the governments are taking are different. The adoption will be different. What I believe is that the ones that embrace technology to manage this pandemic, they will do a better work. And I think that everybody is now talking about the South Korean experience, and it's a good example of this. And not only because they use efficiently the technology, but another thing that I strongly believe is not just technology itself, it's embed the technology into all the flow to make it a seamless experience. So as much connected you have all the healthcare system, the better the flow that you will allow. And yeah, I think I would say this is my point.
And Nuria, because I know that you are very well informed about what is happening in different countries. So But yeah, like what Cristian was saying, it seems like some governments have been more digital than others. Maybe is there any example you like, especially from other countries? What can we
Yes,
learn?
of course. Yes. Well, with this pandemic, we have seen that the different healthcare systems and in all the world have been putting into the healthcare system like different digital solutions. For example, in China, in the telemedicine center, they did like a public and private initiative with also Huawei, and they implemented a full service for telemedicine, so they can assist these patients. And also, we have the example of South Korea with the GPS tracker to avoid more infections and to really track in which places were these people infected with COVID-19. But also in the USA, they have been doing a lot of partnership with private and public institutions to implement also telemedicine platform. Also, we have some examples on China also of chatbot. So I think that all the governments has answered very quickly to this pandemic because they have really understood that it was a need, as we have mentioned before. And I think that, yes, of course, this is something that it's going to last because it's a need for the healthcare system, and all the costs that they are reducing are bigger. And let's gonna see what happens with the healthcare systems once this pandemic will stop being less impact, no, for the healthcare system. Let's gonna see if it will be like a second way of doing this treatment with these patients. But of course, I'm sure that it will be like forever, like this implementation. Mm-hmm.
Thank you, Nuria. And Jordi, what do you think about the future? How do you see the future?
No, the future is
digital?
The future must be digital. We must stop talking about digital because it must be totally interconnected digital. The future is, we cannot say now wonderful adjective because we are in a very sad situation, but the future should be optimistically better than now in this aspect. Of course, these implementations will be ready in the future. The only thing that maybe with all the efforts that all the governments are gonna do, all the private institutions all together, can we say that we could stop a futurable pandemic? Well, as you say, a pandemic has many components. As you remember, a Canadian company, Blue Dot, saw a little bit the initial outbreak, no, of the epidemic in Wuhan. No, one thing is to see that something is happening, and another thing is to be able to tackle, not to control, to stop it. No, so there are many digital solutions that can really tackle down the different aspects of the pipeline of and this epidemic has outbreak now, and then how it goes increasing. But the attitude, the education, many other aspects are important. The solidarity between people, and all these things that now everybody knows about, the RO, the tax of contagion, the tax of all these things that we will know now here in our heads, but that before people didn't have. But remember, in 1918, 1 year later, people were talking about this news that today appear that they're now thinking about reusing the blood of people that has gone through immunoglobulins. That was forgotten, no. But of course, now we have a big company here in Spain called Grifols that is testing that now in California. And these things that were done 100 years ago, that can be reused now. So the thing is how you can reuse things, and just a metaphor, to make for digital health. What we will use now to help stop the outbreak, as Cristian and Nuria said very well, how it will be used then to prevent, and if it appears, to stop it. But I don't know if we can say and affirm that the technology will ever stop a pandemic, because a pandemic can be due to many factors. No?
Mm-hmm. Thank you very much, Jordi. Well, let's go back to the audience. We're going to pick another question. Cristian, this is for you because it's for Mediktor. A curiosity, where do you receive more COVID consultations? And also, how many countries are currently using Mediktor APP? But first, Where do you receive more COVID consultations?
Well, since we launched our first version of Mediktor in Spanish, now we are available in 13 languages, but we have a lot of traffic from Latin American speaking countries. And of course, main country is Spain, as is where we are based, and we do more noise, I would say, in the media. But yeah, I would say from Latin speaking countries mainly.
Mm-hmm.
And
Okay.
but in total, we had consultations on Mediktor from more than 180 companies, which is really nuts. But it's like this. When I see it in Google Analytics, I just freak out. What is these people in these faraway countries doing in our website? But they do. I think that we are talking about a global need, and this need, as I said before, is not well solved. So we can gather the attention of people even without doing any publicity on our website.
Great. This is something that is a question from me because I don't want to leave the room without talking about regulation. Well, now that there is a rush into implementing technology and using medical devices, regulation is changing in real time. Now it's moving fast. What is the positive impact for the ecosystem and also for society? Jordi, what do you think?
Sorry, it break out a moment.
Do you want me to remind? Yeah, repeat the question?
Yeah, because it break out a moment.
Okay. It was about regulation, and we were saying that now that there is a rush into implementing technology and all the medical devices, it seems that now regulation is really changing in real time. So what is the positive impact of that change?
Yeah, obviously there is a new regulation that has been implemented in the last 2 years, and now it had to be the culmination, no? The peak on that implementation on 26th of May. But of course, the circuits, the pipelines of regulation of many of these new control trials these days, or the implementation of digital tools is changing. No, in some hospitals, it's not that ethical committee, but another another committee that is tackling down these issues. So basically, it has to change in these days a lot. It will change a lot. But basically, it's not important because right now, honestly, I've seen in different hospitals, in different administrations, to do things that 2-3 weeks ago would have been impossible. But right now, everybody has the mentality that, okay, it's an exception, and it's possible, and we have a quick reglementation that under this pilot, because if everything is under a pilot and there is a research associated, then the rules of normality do not apply there. No? Well, the regulation should be keeping the path of technology. This is an oxymoron because it's a journey, but this is impossible. You cannot try to convince the regulator to be at the path of the innovation. However, if the regulators are not within this path, they will notice that for an epidemic, for other reasons, they will not be able to cope with the possibilities the technology can give to them. No? So they will have to put more resources in understanding how these regulators must change, not only in the pandemic now, but always react quickly, and that is very important.
Thank you. Nuria, what do you think?
Well, also as we are collaborating in this initiative from the COVID-19 with the Spanish Association of Privacy, we know that in a pandemic crisis, the security and the safety of the population, it's the first thing. So we know that the regulation has some exceptions. This does not mean that it's like decreasing the quality and the standards, of course, but it's true that all the process that in a normal way healthcare technologies has to pass. For example, in a hospital, talking with the ethics commitment and all the people of compliance, it's true that are more like, let's say, easy to face due to the urgent need that these healthcare systems have. We know that the regulation, also the medical regulation that it was going to happen on May will probably change. Yesterday, the European Commission put one news about that. So we know that now we are in a very urgent and critical moment where technology can really help has to be first, more than all like the bureaucratic process. But of course, we have to guarantee this. In our case, for example, when we started developing the platform, we encrypted all the data and we didn't collect any personal data inside of the platform. So all these things that are like basic things from security and privacy has to be. But it's true that the decision makers are more open and needed to implement this technology due to the crisis and the need that this healthcare system has.
Thank you, Nuria. And Cristian, what about you? What do you think?
Well, I think that, of course, we are in a unique opportunity to try to drive the change and finally have the virtual medical consultation regulated properly, to make things safe but straightforward. So I think that Luis could explain more about what Barcelona Health Hub is doing in this sense. But I think that there's a unique opportunity to promote a change, because we all need it. We not only want it as patients, because I think on the patient side, even more in the younger people, there's a wish to access more digitally to healthcare, but we need also to regulate it to make it safe for physicians and for everybody involved in this process. So I think that we have a unique opportunity, and Barcelona Health Hub will take a move on that.
Okay. Now, Cristian, now that I have you on a screen, I want to ask you another question from the public. Is Mediktor similar to Ada Health?
Well, I would say that Ada Health is similar to Mediktor. But yes, of course, yes, absolutely. They are a good competitor. They do a good job. It's sad that they don't do the efforts to validate as much the technology as we do. But I like what they do, and it's a good competitor.
Great, thank you. To sum up, I want you to give me a short sentence, kind of a tweet, a headline, telling the people in charge of making decisions why they should implement digital health tools. Who wants to start? Jordi?
Yeah.
You go? Okay.
Yeah.
Why should they implement digital health tools to the decision makers?
Yeah. Pandemic is an exponential thing. So if you implement digital tools, it will be slow at the beginning, but then it will be exponential how you can treat people. So that's why right now with this comparison, they should really be convinced that it's the moment, not only for now, but to implement it.
Thank you very much. Nuria, your turn.
Okay, yes. So for me, now is the moment. So now is the moment to really demonstrate the value of all the things that we are doing. And the second thing is that we must work together, all the stakeholders together, technology companies, but also regulators, but also healthcare professionals. So now is the moment, and all together.
Great. And Cristian?
Well, I would say that for me it was obvious before. Now it's a need. We need it not only for what we are facing, which is a big challenge, but the challenge of the future of healthcare in general. So please take the chance and embrace innovation.
Thank you very much. Well, we have to leave it here. It is a pity that we have run out of time. I don't know, maybe we have a couple of more minutes if any of the panelists would like to say something. Is there anything that you want to add? You feel like sharing with the audience?
No, thank you.
Go, Jordi, go.
Yeah, no, thank you. Thank you to Barcelona Health Hub to be always so supportive of initiatives, no? And as I say, as a continuity of these seminars, we will have one seminar every week, but also between them, we'll have this EpidemiXs TV, in consonance with this philosophy of informing people, of to disseminate the right information and to tackle down specific topics these days that have to do with the epidemics crisis, but also with digital health in many aspects. So again, thank you for all the people who have been listening to us. And thank you again to Barcelona Health Hub because it's a wonderful initiative.
Thank you, Jordi. Nuria, is there something that you want to add before we leave?
Well, I want to give also the thank you to Barcelona Health Hub, and also I would like to thank you to all the people that has been contact us during these 2 weeks, the Spanish Association of Privacy, but also people working in COVID-19 warriors. So all the people that has been talking with us and doing all this work, all these initiatives. More than other projects that we are doing in the company, I would like to thank them. And also, of course, that if any people that works in a public hospital wants to use for free our platform, we will be very welcome to offer that and to help in these difficult moments. And yeah, and thank you so much.
Well, that is a great offer indeed. Cristian, what would you share with us to close the session?
Also, thank you everyone involved in organizing this. It's great. It's great to see that we can do it. It works, and we can still share the world beyond the physical limitations that we have these days. And also, we are willing to help anyone in healthcare that wants to embrace our technology. We have already offered for free our technology to the government, and well, we will be glad to help. So please reach us if you think that we can help you.
Yeah, indeed. I think it's great to see how the ecosystem is working hand in hand and fighting together against this situation. That's great. I really enjoyed the conversation, and I'm sure the audience did too. And well, now it's time to leave, but before, I would like to share with you a current opportunity for companies. Let me share my screen.
Yeah, you are in.
Digital solutions to fight coronavirus wanted. Yeah, can you see it? Yes. Well, we are looking for companies that have technologies that are already available. That is important, that are already available in the market, because we are gathering all that information, and we will be sharing that info with the European Commission and with the international healthcare services. We are using a platform that is called eHealth Hub platform. It's 100% for free, and it is very easy to use. You just have to go to the platform, you create your profile, and you just have to explain how you help coronavirus, your solution, and you use the tag coronavirus. What we are going to do is that we generate one link. I don't know, maybe if my colleague Aline, she can share the link on the chat. And the European Commission will be able just in one click to see all the European digital solutions that are ready for helping the healthcare services and also the patients. So we think it's a very good opportunity also for visibility for companies that are doing a big effort. And now, yes, that's really all from my side. We have to say goodbye, but good news. There will be more Barcelona Health Hub series. This has been only the first one, more to come. The next one is next week. So is on April the 1st, yeah. We will discuss about how to stay mentally healthy during a pandemic. Quite relevant topic. How to stay healthy, mentally healthy during a pandemic. So check the Barcelona Health Hub website for more information. See you next week and stay safe. Thank you very much to all.
Bye.